Hi everyone. I'm Allison. I'm a DPT at CORA here in Clinton, Tennessee, and I am here to talk to you about what CORA can do for kids. We have a program called CORAkids, and we provide a lot of different services to children of all ages. I recently became a board certified clinical specialist in pediatrics, and I've worked for CORA for 2 years and in pediatrics for 11 years total. The Clinton CORA is an outpatients clinic. We have aquatics and land therapy. We see adults and children, of course. We see all different adults that have had things like total joint replacements or rotator cuff repairs, anything that you would normally see in an adult population, as well as kids. And in kids, we see things, kids that have cerebral palsy, they have spina bifida, kids that have a broken arm, they've fallen and fractured their arm or their leg. We also see kids on the sensory system, on the sensory spectrum, on autism spectrum. We see kids as well as down to babies. We see infants that have congenital defects. We have infants that have torticollis, as well as brachial plexus injury, which is when they have a pull in their neck and shoulder and it causes some deficits in their arms. My youngest at this point has been 7 days old. So it's pretty fun to work with the little ones, obviously. As I said, our clinic here has land and aquatic. We're here in our pediatric room right now, and we have all kinds of fun stuff. We have games and toys, balls, things to throw, but we also have balance beams, wedges, therapeutic activity pieces of equipment, foam pads, discs, balance boards, things like that. We have a tilt board and sensory tunnel, all kinds of fun stuff for kids. In the pool, we have, the pool is really great for a lot of different things. The possibilities are kind of endless with the pool, but it's great for balance and posture. It helps increase core stability. It challenges people without making them nervous that they are gonna fall and hurt themselves, because they can just fall in the pool and it doesn't hurt. It is also great for our sensory stim folks, that it's good for the sensory system, for the sensory response. It gives input into the entire body all at once, which helps calm kids and decrease some of the noxious stimulus that they might have when their sensory system is overwhelming. That helps our kids on the autism spectrum or with sensory processing disorders. Another thing the water is great for is tonal inhibition. That's when you have some spasticity in your limbs. You might have an arm that's drawn up or a leg that's drawn up, and the water helps decrease some of that just with the properties of the water. Our pool is a therapeutic temperature, so it's warm, feels good, allows everybody to kind of relax and stretch out. It's good for general stress reduction for our kids. It's fun, they enjoy it, they get to play. It causes some relaxation of muscles, their general total body, as well as their mind. CORA also has other clinics that do different services for kids. We have clinics that have physical therapists, occupational therapists, and speech and language pathologists. So they give PT, OT, and speech. Sometimes all kids need all 3 disciplines. So that's really great. We have clinicians that go into the school system, and clinicians that also go into the home to do early intervention, which is for our kids that are like birth to 3 years old. That helps, as I said, that helps treat kids across the whole discipline all in one clinic, which is really nice. Another aspect that we can help kids in is in equipment ordering or orthotics fitting. We work with the parent and also with the medical equipment provider to find the right piece of equipment. Might be a wheelchair or a stander or a gait trainer that they need. Or it might be an AFO, a brace that they need on their ankle, or an arm brace or a wrist brace. We can help with the measuring and the fitting for that, and we work together with the family as well as the medical provider to fit the right thing for each kid. When our therapists that work in the school systems also do that, they do a great job getting equipment for kids in the school systems, either from the school to borrow something or also through a provider. One of the biggest changes CORA has had this year, of course, is to, as a result of the pandemic, we added telehealth. So telehealth is when you're on your computer and I'm on my computer in the clinic and you're at home. And you can use your computer, you can use your phone, you might use a tablet or an iPad. We started that here in this clinic in March and April when we first went into a quarantine and stay-at-home orders were ordered here in Tennessee in order to help protect CORA's families and their health. CORA is doing a lot of great sanitation things. We're wearing masks, we're doing extra cleaning and extra wiping down of every piece of equipment and toys and things like that. But it's also a little too nerve-wracking for some folks to come out at this time. And so they may have a kid that's immunosuppressed or a family member that has another health concern, and that may be why they choose to stay home right now. And the great thing is that we can provide them with services so that they can still keep going with their care so that they don't have a lapse in their treatment. What I like about telehealth is that it's convenient to the patient. They don't have to load up the sibling, load up the equipment, load up all their bags, and drive all the way to the clinic, get their therapy, and then reload everything back up. They can just do it right there in their home. They can use equipment that they have at home, and it can just be as easy as toys that they have, or their own couch or their bed, anything like that. I've noticed that patients have been more compliant. If a family member is sick and they wouldn't be able to come into the clinic because their kid is sick, they might be able to still do their telehealth because they can go to a different room or do something like that. I've had patients that have gone to the grandparents' house and they would have missed their therapy because they were, across town and they couldn't come out to the clinic. But instead they're able to do that because they can do it via telehealth. So it is a more natural environment. It's great for us to see the natural environment that the kids are in. It allows us to help troubleshoot with the family or brainstorm some ways in which the family can modify some activities for the kid. If they're having difficulty with eating, we might be able to give them a better postural suggestion, or the speech and language pathologist and the OT may be able to work better with exactly what piece of equipment they're using at home, whether it be the fork or an adaptive device. It also allows us to see equipment or devices or even a room setup that is too big to bring into a clinic in an outpatient setting. So we can sometimes help troubleshoot that with the family. Like if you move that chair just a little bit to this way, you'll have more room to transfer and it'll be better for your body and better for your mechanics. So that just really gives kids an incentive to stay active and stay healthy right now and not have lapse in their treatment, even though they're not getting their normal routine. Some of our kids are not going to school right now. They're not getting their usual services in the school system. And telehealth has been a really great thing for that, so that they don't have this big regression in their progress of their motor skills. It's really great for us to be able to see the space that they're working in. So you could say, hey, that's a great toy. They seem to be motivated by that toy. So you can ask the parent or the guardian to use that toy instead of a different toy that we've been trying to work with. So it's easy for us to see what's best for them and what we can use in their home. Because the ultimate goal is to make PT fun, or therapy fun, any of the services. Because with kids, it's all about play with a purpose. I always tell my families, I kind of put therapeutic activities in the way of kids' play so that they're having still a great playtime, but they're actually doing something therapeutic. So what I'd like to do now is introduce my current student, Lauren Isles. She's a PTA student from our local Rome State Community College, which is here locally in East Tennessee. She's on a 6-week rotation with us, and she's about halfway through, a little bit more. And she had an interest in peds, so she ended up at our clinic and with me specifically. So she's going to demo a few things that we can do at home with our kids at home, things that we've been doing with them on telehealth. So the first thing we're going to demonstrate is with balance and core stability. So just grab a pillow, a couch cushion, something thick, maybe a decorative pillow or 2 pillows stuck into one pillowcase. And you can stand in double limb stance, so standing on both feet on the pillow, and it helps balance. Kids can throw toys, or they can watch a movie or a TV show that they like. They can interact with a family member, or they can play a video game or whatever kids like to do these days. You can advance it to standing on one leg, so that makes it a little tougher. And of course they can continue to do these activities just to make the challenge even more, either with their hands or with their a family member interacting with them. You can do patty cake, all kinds of fun things, sing songs. And you can advance it even more to do what we call tandem. So if you turn the pillow, you can put one foot in front of the other foot, just like that, and really challenge the balance there. And again, go back to those same activities. Thank you, Lauren, you can sit down. One of the things that we can do while we're doing these activities is educate the parents on, what's a better handling technique, or where should you stand so that you can make sure the patient doesn't fall down, or give them a handhold if they need it, things like that. All right, so another thing that we work on with a lot of our kiddos is cross body work and crossing midline work. And it helps with integrating both sides of the brain hemisphere, and helps increase sensory integration and things like that, which is really good for our kids on the spectrum and with sensory processing disorders. So what we've been doing with that mostly is doing half kneel. So that's when one knee up and one knee is down. We grab stuffed animals or a toy that they may have, and you can cross over and put it in the bucket. Perfect. And if kids like to throw, you can put the bucket further away and throw it, anything like that. And then of course we have kids switch sides and do it again on the other side. So, perfect. All right, so another thing we're gonna show you is a way to challenge the vestibular system. The vestibular system is important in balance and coordination work. So what we do with this one is we do what we call a single leg deadlift. So the toy goes in front, so you can use the same kind of stuffed animals or toys. The kids are having fun just showing me the different toys that they have. And you can reach down with one leg and balance, perfect, and then throw in the crossbody, or you can throw at a target, whatever works for them. Again, it helps with the sensory integration, balance work, and increased coordination. Perfect. And then of course you do it on the other side. Last thing we're going to show you is stretching. Stretching is really important for kids as well as adults. And so one of the biggest things we have to stretch is the hamstrings. That's the back of the leg. And so we just have kids sit in what we call a V-sit. And they can reach forward to touch their toes, reach forward to the center. They can try to reach again for a toy and throw. They can reach for a patty cake, or they can sing a song or watch TV just while they're in this position. Sometimes just that position is enough of a stretch for some of our kids, and you can get a prolonged stretch when we're like watching TV or playing on their computers or doing something like that. So thank you, Lauren. Thanks everybody so much for watching. We just wanted to give you kind of an idea of what CORAkids can do and what CORA's program is for pediatrics at this time. We have therapists that are in the school systems, we have therapists in the homes, we have therapists in outpatient settings like this. And we just wanted to give you a little snippet of what we can do. Thank you so much for watching, and I hope you enjoyed. Thanks.